Hi everyone, Dr. Houghtaling here again at Hamilton Animal Hospital. I am the medical director here and I'm going to be talking through what you can expect before, during, and after your pet's surgery. The most important things you can do before the procedure are communicating with us if your pet has any changes, either in their behavior or the medication that they've been getting, and please make sure that they come fasted. Now, in recent years, we found that only 6 hours is what is needed for most pets before they go under surgery. And the reason that we need to fast is so their stomach is empty, they don't get nauseous or vomit during the procedure, which can be extremely risky. So 6 hours of fasting is ideal for most pets, but if they're small or very young, we might need to do even shorter of a fast. So just let us know if you have questions on that. Make sure that you let the technician know when you drop off that day if you've fed them, and it's always okay to provide water up until the time of surgery. So when you do come on the day of surgery, usually drop off is around 7:30. We will go over the procedure again, we'll talk through the estimate, and we'll go over briefly the next steps. Make sure at this point you let us know if your pet got medication or any food or snacks that morning. If they didn't and we're good to proceed, then I will, or another one of our doctors will proceed to examine your pet. What we're looking for at this point is, do they have any new heart murmurs? Are they hydrated? Is there anything else going on that could add to the surgical risk? And if not, we'll give them a very light dose of sedation and we'll place an IV catheter. That way we can give them fluids and injections painlessly throughout the day. So nowadays, we have the benefit of many types of anesthetic monitoring, and this includes checking a pet's temperature, blood pressure, all of their breathing values, including CO2 and their oxygen going in and out. And we can also check their heart rate and rhythm. That way, if they have an arrhythmia, we can adjust and be as safe as possible. When your pet recovers, they're going to be extremely confused. Unfortunately, we can't speak to them and let them know what's going on and that everything's okay. So we'll have medications on board as needed, so it's a nice, seamless recovery. Their bodies are also going to be very cold, so we'll make sure that we keep them on warmers and have a nice, smooth sailing recovery. With anesthesia, while much safer nowadays with all this monitoring, preoperative blood work, and preoperative exams, risks are very low, but unfortunately there still are some potential risks. So for healthy pets, dogs specifically, it's about 1 in 2,000 will experience a serious complication during surgery. In cats, it's about 1 in 900. So there is a low but very real risk. This is why we run preoperative blood work to make sure their kidneys and their liver can tolerate medication. This is why we listen to them and see how they look both before and right before the surgery when we're going to induce them. So when you come and pick up your pet the day of surgery, they're going to be a little bit anxious. They don't know what just happened. They might be a little bit tender, and that's okay. The main thing is you want to watch them for significant bleeding or swelling, or if they're extremely stressed, let us know. A little bit of bleeding from their mouth if they had dental extractions, that's okay. Just make sure that if they had an incision, you keep that cone on so they don't bite or lick at the incision, because that can delay healing. A few days, they may or may not eat. Just let us know if they're not eating anything for more than a couple of days. And that combination of anesthesia and opioid medications likely will make them pretty constipated for about 2 days, and that's expected. So in closing, hopefully these videos help illustrate what goes on behind our doors. And if you have any questions, you can always reach out, and we would love to show you back here and go over what goes on before, during, and after your procedures. If you have a surgery or a dental and you want to get scheduled, we would love to set that up. Thanks.